This is lecture video for the joint lecture. As always, make sure you go through the lecture note thoroughly on your own, as I won't be covering every single thing in this lecture video. It's always my goal to make it short so that people's attention can last. Now, let's begin. Joints, things related to joints oftentimes begin with the word root of arthro. So things like arthritis means inflammation of the joint. Okay. Arthroscopy, like a specific type of surgical procedure that's done on joints. Okay. Now, when we look at joints, we can classify them by how movable they are. So that's a functional classification. But we can also classify them by the structural component. Okay, what binds those bones together to create that joint, whether or not it's got a joint cavity, etc. Okay, so when we classify it by its degree of mobility, we can classify it into synarthrosis, which is immovable, okay, and epiarthrosis, which is slightly movable. Diarthrosis are freely movable, okay, and you can see that the freely movable ones are the ones that are more common in our appendicular skeleton, okay, or more commonly seen in our appendicular skeleton. Whereas the more immovable ones are usually more commonly found in the axial skeleton that helps protect our brain and our spinal cord. And when we look at structural classification of our joints, okay, that is based on what material binds those bones together, whether or not there is a joint cavity, etc. So this kind of shows you the organization of this class, is that we're going to go into each structural class of joint, and then within each class there are subtypes. And then each subtype can either be synarthrosis, it could be, or synarthrotic, meaning that it's immobile. It could be diarthrotic, meaning it's freely movable, or it can be epiarthrotic, meaning it's slightly movable. We're going to now look at the first structural class called the fibrous joints. Fibrous joints, okay, there are different types, but together they're defined by the fact that the bones involved are connected by fibrous connective tissue, and there is a lack of joint cavity. Most of them are immovable, or they're at most slightly movable. Okay. And the three types are suture joints, syndesmosis, there's gomphosis. Okay. Suture joints and gomphosis are immovable. Gomphosis is only found in the tooth socket. Okay, so when you get your tooth pulled, okay, you feel that tear. That's those ligaments being pulled. Suture joints is only found in the skull, between your skull bones. Okay. And they allow your skull to expand during your development. When you become adult, when you reach middle age, those fibrous tissue will eventually ossify, meaning that they become bone. And when it ossifies, those closed sutures are now called synostosis. So what defines suture bone is that those bones are tightly bound together by a very small amount of fibrous tissue. Okay. And that provides for a very good protection for what's underneath, which is your pressure spring. In syndesmosis, those bones are connected by ligaments, and so there is a range of mobility depending on the length of those ligament fibers. In the distal tibiofibular joint, which is between the tibia and the fibula, but on the end of those bones that are farther away from the point of attachment. Okay, so that's why this is the distal joint. That one is considered synarthrotic because it's completely immovable. But there are cases they are fairly movable, like the interosseous membrane between your radius and ulna. Okay. That one would be considered diarthrotic because it's freely movable. Now the kyphosis, as I mentioned, is really only found in your teeth, not in your teeth, underneath the root of your teeth. Okay. So those are called periodontal ligament. So this is just included this table again to help you kind of look at the overview of this first structural class we just mentioned. Now we're going to move on to the second structural class called the cartilaginous joints. This type of joint, they're defined by being united by cartilage. Okay? And there are different types of cartilage that can unite them. Okay? So that divides it further into two types, synchondrosis and symphysis. In synchondrosis, those bones are united by hyaline cartilage. And some examples include epiphyseal plates, which is the type of temporary hyaline cartilage joint that becomes ossified when you're an adult. So this is the growth plate. Okay. When you're growing in your development, when you're growing taller, you're growing from this part. Okay. Eventually, when you reach adulthood, this part ossifies. Another example of synchondrosis is the first sternocostal joint. So if you recall what costal means, costal means rib. Sternal is referring to the sternum. Sternum is your breastbone. So this is your sternum, this is your rib. So the joint between them, the first joint between those two, called the first sternocostal joint. Okay. So that is also joined by a hyaline cartilage. Synchondrosis is synarthrotic, meaning they are completely immovable. Symphysis is the second type of cartilaginous joint. And in this type of joint, those bones are united by fibrocartilage. And so that tough material helps it withstand tension and compression. And we've mentioned this in the first unit. If you recall, some locations that we can find that fibrocartilage are intervertebral discs, your pubic symphysis. Okay, and in this type of joint, you can still see hyaline cartilage, and the hyaline cartilage in this type of joint serves as an articular cartilage. Okay? So in the center, really, you see the hyaline cartilage, and then surrounded by that annulus fibrosus, which is fibrocartilage. Okay. So this type of joint still has hyaline cartilage, but on top of that, you also see, or around that, you also see fibrocartilage. Now, synovial joints are the most movable type of joint. They're all diarthrotic. These are the ones that allow you to wave your arm, to kick someone, to play, to freely move like a normal human being. Right? So, most movable type of joint. They're also characterized by a joint cavity that's filled with the synovial fluid. And so I wanted to learn the structural anatomy of this synovial, a typical synovial joint. Okay. Now within synovial joints, you can further divide it into these 6 subcategories. We're not gonna go into these, so I'm not gonna expect you to know these subtypes. But you have to know synovial joints is a class. Okay, what characterizes them? And that's what we're going to look at now. Okay. So first of all, you find in synovial joints an articular cartilage where the ends of the opposite bones are covered with hyaline cartilage. And that allows your joints to absorb compression and prevent your bones from hitting against one another. They also feature a joint cavity that holds a small amount of synovial fluid. Okay, and that synovial fluid serves to lubricate the joint. When you get an inflammation, the doctor is going to stick a needle in here and then draw the fluid to see what kind of stuff is present. Is it bacteria? Is it, just some kind of autoimmune disease, right? That's where they're drawing the fluid from. Okay. Now this articular capsule has a few layers around it. And this is, I distinctively remember this is on the exam, so make sure you know this. Okay, there are 2-layer capsules that encloses this joint cavity. There's the fibrous layer. It's actually right here. Okay. It's made of dense, irregular connective tissue that directly helps to strengthen this joint. Okay. Within that, there is the synovial membrane, which is made of loose connective tissue, and it lines this inner cavity. It actually creates that synovial fluid and help lubricate the joint. So it lines the internal joint surfaces. Synovial fluid is this viscous fluid, but when you get inflammation or infection, the color can turn bloody or other colors. Okay. A few other ligaments that may be found inside or outside the joint, depending on the specific joint. Okay. They're called extracapsular or intracapsular ligaments, respectively. Okay. So the ones that will be found outside will be called extracapsular ligament. If you find them inside, like your ACL, your PCL, those will be intracapsular ligaments. Okay. Which is a magnified view. By the way, if you see these, you can just ignore. I used to use this student response system when we were having face-to-face class. And you can ignore that. Anyhow, now we're gonna look further into the general structure of synovial joints. Inside these joints, there are plenty sensory nerves. Okay, so when you get those ligaments torn, it will feel painful. Okay. They also have a rich blood supply. Okay. Now, some synovial joints will contain an articular disc. Okay, an example is the temporal mandibular joint. That's your TMJ, but also at the knee joints. Okay. And that is particularly useful in joints where those bones have slightly different shape. So it allows for a more smooth movement.